In this video, we'll talk about this type of OR table. This is your standard OR table. This is an older version that we use for training. There are newer versions now, but they still operate the same way. This is the old Skytron Elite. Starting at the bottom, it's got 4 pads that come down and lock the bed in place. It has a base, it has a column that can go up and down, and then it has the bed that the patient lays on. The bed's broken up into different parts. You've got the headpiece, you've got the back, and then you've got the leg piece. In a lot of these beds, the leg piece, the headpiece can come off and be rearranged, taken off completely, whatever you need for the surgery. This bed can also swivel around so that this base is down by the foot. So if you're doing head and neck surgery, they may want this base down by the foot so they have room underneath the patient to put their feet, or pedals and different things like that. Something to be mindful of. So I'll go through the different positions that this bed can do. It has just your basic table up, table down function. It can go pretty high, so you have to make sure your patient's secured before you start moving the table around. The number one thing that you want to do before you start positioning the patient is make sure that your bed is locked. If my bed's unlocked, these pads down here will be up off the floor. And a lot of times when our nursing assistants are cleaning the rooms, they're unlocking the bed and move it out of the way so they can mop underneath it. A lot of times they don't lock the bed back, or somebody else may unlock the bed for whatever reason and they don't lock it back. Make sure this bed is locked before you put a patient on it. It's very simple. A lot of times there's a brake lock on the controller. If there's not, a lot of times you press any positioning button, it will automatically lock the bed before it allows you to use these positioning functions. So like I said, table up, table down. You got back up. Put them in a beach chair sitting type of position. You can airplane to the left or right, depending on what the surgeon, surgeon may need different access or different views, and airplaning the bed will help them. You've got Trendelenburg, which is head down. You want to make sure you're using the correct Trendelenburg positioning devices to keep the patient from sliding off the head of the bed. And then you've got reverse Trendelenburg, head up, feet down. They can be used for bariatric surgery. So this would be used pretty steep. You'd have a footboard on there. This is used to take the bowels and everything to make sure that their gravity is pulling them down so that the surgeon has good visual access to work on the stomach. The reverse is true if you're doing Trendelenburg, which is head down, feet up. It's going to take everything and make it fall up. So if they're doing some kind of bowel surgery, they may need steep Trendelenburg to push everything down so they can access, especially if they're doing the end of the bowel. If they're doing a sigmoid or something like that, they may need very steep Trendelenburg. There's usually like a neutral or return that will put the table back in a neutral level position. We've also got leg down, which will take that down to 90 degrees. Leg up. Really won't let you hyperextend the legs, only lets you go down. You've got kidney up and kidney down, which will break the bed in half and jackknife the patient to expose their side more, where they have better access to the kidney if that's what they're working on. So this is one of the feet that lock. I'll show you when I actually unlock the bed. That foot comes up, comes off the floor. Now the bed can be moved around. Before I position the patient or get the patient on the table, I want to make sure that this bed is locked. So you can see the feet going back down and securing this table. And there's 4 of them on each corner. Here's the controller. It's got all the different positioning functions that I showed you earlier. Got a power on. Usually down here by the power cord, there's some type of power switch, manual switches. It's where your power cord connects. It's where maybe you have a fuse that can be reset. Underneath the bed, you've got this lock right here, which allows the bed to be rotated, and you can switch the orientation of where the base of the foot is. Again, you've got your headpiece that's removable. It's got little locks under here that you would loosen up and you could remove it. And then a lot of beds, the foot piece comes off. It has handles under here that you can depress and take the footboard off if you need to. One important feature of this bed is the rail system. It goes around the edge of the bed. This is somewhat of a universal system. It allows you to take different clamps and positioning devices and secure them to the side of the bed. A lot of times you'll see these little cutouts right here and here. It's to drop a little positioning device down into it. This is called a whirly bird. Different places call it different things. You can see it's got 4 little points that will drop down into this little groove. So you hook the top teeth on, and then the bottom one comes down, and now it's secured on the bed, and I can put a positioning device through there and tighten it up, and it will keep it in place. Another thing that it's used for is the safety strap to put it through and go over the patient. The other one's on the other side. One of the other main functions is the arm board. The arm board clamps to this. It has a little clamp on the bottom. You can see right here. It's got a little lever that moves this little bottom jaw. What you do, hold this lever down to where the bottom jaw's down, come in at an angle, and then drop it down until you feel it lock. Like that. And then you shake it around and make sure it's secured. Now that one's on there. So there's a bunch of different type of positioning devices that can be used for the beds. They're usually procedure specific. So your facility may have lots of different kinds that you have to learn. But like I said, most of them will fit on this little universal rail, working rail, whatever you want to call it.